So my name is Lisa Wynne and I am the Parkinson's disease nurse specialist for the Parkinson's Association of Ireland. Today I just wanted to discuss the issue of bowel and bladder symptoms which a person with Parkinson's may experience. So just a brief overview of what Parkinson's disease is. It's a progressive neurological movement disorder, and although it primarily affects movement, there are both motor and non-motor symptoms associated with it. It's a loss of a chemical called dopamine, and people with Parkinson's lose this chemical at a faster rate than others. So we all lose it as we age, but those with Parkinson's diagnosed lose dopamine at a faster rate. The reason being is unknown really, but researchers suspect that in most cases it's a combination of genetic factors, environmental factors that may cause the dopamine producing nerve cells in the brain to die off. Its progression is variable. So in some people it might progress more slowly than others or more rapidly, but symptoms can be effectively controlled with medication for many years. And the symptoms are not the same from one person to the next, nor is the treatment. And the vast majority of cases in Parkinson's are not inherited, although there is a genetic factor. It's most commonly diagnosed with people in their 60s. However, it can affect people younger. Early onset Parkinson's would be if you are diagnosed between the age of 40 to 60 years of age. Young onset Parkinson's would be diagnosis between the ages of 21 and 40 years of age. And juvenile Parkinsonism is before the age of 20. And approximately 12,000 people, according to the most recent research, are living in Ireland with Parkinson's disease. Well, I'm fully aware that constipation, bowel issues and bladder issues are something that people struggle to speak about. But coming from my field, it's something that I hear about every single day. Majority of people that would ring me to say that they feel that there is lack of effect from their medication for Parkinson's, or that their symptoms have increased over a period of a few weeks or a few days. The first question that I would ask is, are your bowels going? And are they going effectively? Because it's something that is so closely linked to the absorption of your Parkinson's medications and the effective working of your Parkinson's medications. And people do see very quick improvements with their Parkinson's symptoms if this is the main reason. And if you're constipated and you clear the bowel with natural laxatives or with laxatives that may have been prescribed by your consultant, the effect is pretty immediate and your symptoms should start to improve. So bowel symptoms is the topic that I'm going to cover today, along with bladder symptoms. And the most common bowel problem for people with Parkinson's is constipation. It affects approximately 50% of Parkinson's disease patients. However, I would believe that percentage to be a lot higher from dealing with calls through the support line and the one-to-one Zoom clinics that I offer. Constipation is classed as less than 3 bowel movements a week, and constipation can exacerbate Parkinson's symptoms, mainly due to the reduced uptake and effectiveness of the Parkinson's medication. So within constipation itself, you have a muscle impairment within the bowel. So the bowel itself is a huge muscle that weakens over time with Parkinson's disease. It may be medications that cause constipation. It may be, unfortunately, some of the Parkinson's medications, or codeine is another medication that can cause constipation. It may be due to decreased mobility. So if you are suffering with motor symptoms and your mobility has decreased, this may also contribute to constipation. And then delayed gastric emptying, meaning that the contents leave your stomach slower and it takes longer for them to leave your stomach and enter the bowel. And this is another reason then that we ensure that levodopa is taken without food, so that you give the Parkinson's medication the best opportunity to pass through the stomach and into the bowel without any competition from food if there's a delayed gastric emptying. And also another reason for constipation then may be inadequate fluid intake or an inadequate fiber intake. So bowel symptoms and some things to consider, your normal pattern. How often would you go? Would it be once every 2 days? Would it be twice a day, for example, or would it be once a week? Are you emptying the bowel fully? So do you feel that you've passed a significant bowel motion or that you could spend longer on the toilet? Consistency of the bowel motion. Have you pain when you're passing a bowel motion? Is it difficult to pass it? Are you straining? Or do you suffer from incontinence? And also, have you been prescribed any medicinal laxatives, or do you take any dietary laxatives? So bowel symptoms, as I mentioned, constipation can worsen your symptoms of Parkinson's. And constipation is the #1 reason why a person with Parkinson's would suddenly become worse with symptoms. And this is because your levodopa, so the main component of your Sinemet, Stalevo, or Madapar medication, is absorbed in the bowel. So if your bowel is full to capacity, you're unlikely to get the full benefit out of these drugs. So prevention of constipation is very important, rather than having to be reactive in a crisis mode. Prevention includes exercise, increasing your fluid intake. So if your fluid intake is minimum, we'll then try and sip on water throughout the day to try and increase your fluid intake and make sure that you're not dehydrated. Maintain an balanced diet, such as fruit, vegetables, and your wholemeal breads and cereals. And this all helps with fluid intake to help the fiber work within the bowel motion. Some fruits that are very good would be prunes or pears, and in just a balanced manner. When prescribed laxatives by a physician, ensure that you take them as prescribed, and I'll discuss the laxatives in the next slide. So you have your natural laxatives. You have flax seeds, prunes and pears, as I mentioned, water, and coffee. So coffee is a natural laxative. And then you have stimulant laxatives. So these promote the contraction of the intestines, or the contraction of the bowel muscle. And they promote the movement of the bowel and the movement of the stool. And they take approximately 6 to 8 hours to work. Bulk forming laxatives then increase the bulk of the stool, which in turn then stimulates your bowel to pass the bowel motion. For example, fibrogel would be one of these bulk forming laxatives, but they take approximately 2 to 3 days to work. And you then have osmotic laxatives. So these osmotic laxatives actually draw in fluid or water into the bowel and soften the stools. And these would be an example of lactulose or Movicol, which also take 2 to 3 days to work. But if these are drawing in water in order for it to be effective and work, well then again, the intake of water or fluid throughout the day is very important.
Just pause there for a second. 2 slides ago, you didn't mention, you have a thing on the slide about movement and posture and things like that. I don't think you didn't speak to them.
Okay, sugar. Will I go back?
Yeah, just go back. I can edit this all together. So there you go. See position. You talked about balanced diet. Now, in balanced diet, you didn't mention anything about, you talked about, you know, fruit and vegetables and wholemeal, etc. You didn't mention meat and dairy and things like that.
It's more, I suppose, just mentioning the fruit and vegetables as a fiber rather than
brand, right? Might be useful just to explain why you're focusing on those. That people typically, I don't know what the statistics are, but how many people take enough vegetables and fruit? They concentrate on their potatoes and their meat.
Yeah.
So if you want, you could speak to both of those 2 points.
Yeah, perfect.
And then skip the next one and go to and resume where you want to pick up again. So off you go.
So maintaining a balanced diet is also a good method of prevention of constipation. And a balanced diet would be ensuring that you have sufficient items from each food group in your overall diet throughout the day. So increasing your fiber, such as fruit, vegetables, wholemeal breads and cereals, is very important to prevent constipation, and to avoid possibly eating too many additions of meat or carbohydrates or high sugar and high salt items in your diet.
Just pause for a second. Sorry. Protein, that's a thing Breda often mentions.
Yeah.
Not, competing with levodopa.
Yeah. So that's why, well, first of all, that's why it's on an empty stomach, but then it's also you have to watch your protein intake.
As opposed to your vegetables and your fruit. Yeah, isn't it?
Yeah.
Yeah.
It's the protein in it, and people say, oh, protein, but sure, I don't eat that much meat, but sure, they forget about it being in cheese and dairy, and also in your red meats and white meats. It's not just...
Yeah, so is it.
Yeah, it interacts with the absorption of it.
Yeah. Do you want to redo balanced diet then, and just a major culprit seems to be protein, isn't it?
Yeah, but I suppose that's more in the dietary side for the medication.
Okay.
Whereas here it's more to try and just
get your bowels. Okay.
Yeah, about the bowels.
Yeah. Then leave it if you're ready. Yeah. Off you go.
And allow yourself the time. So maybe set yourself aside a period of time in the morning or in the evening time where you take the time to go to the bathroom, make sure you're in the correct position and that your posture is correct, to allow a bowel motion to happen rather than rushing out the door straight after a meal. It usually works quite well if you keep it a part of your daily routine to ensure that you pass one bowel motion a day. So other bowel issues that you may experience is diarrhea. This may be caused because of an infection or a holiday tummy. It also may be caused because of weak muscle or sphincter control. Medications may cause diarrhea, including laxatives. And then diarrhea, just like constipation, doesn't allow for the proper absorption of your levodopa, specifically medication for Parkinson's. And then if you're poor absorption of this medication, your symptoms will worsen. A weak sphincter will lead to urgency and possibly incontinence. And in this situation, it's not always easy to find a bathroom, and you may feel that you aren't able to control the sphincter muscles or squeeze them, which may lead to leaking. This is something that probably should be addressed with your neurologist or your GP or nurse specialist. And there are physiotherapy exercises that can be given to you by a physiotherapist to help strengthen the weak sphincter muscles. Severe constipation then. So I've spoken about your day-to-day chronic constipation, but severe constipation can lead you to feeling very unwell. It can lead you to feeling very lethargic and nauseated because your bowel is so full, it's putting pressure on your stomach. In the elderly, it's seen to cause confusion and restlessness if they're suffering from severe constipation. It may increase bladder disturbance, so this would increase your bladder urgency and make emptying your bladder more difficult. And then you have the issue of impaction or overflow. So impaction is where your bowel is loaded with fecal matter or with a bowel movement that you're unable to pass. And you may pass overflow, so you may think your bowels are actually going, but the overflow would be described as a loose liquid form that's actually just going around the impaction and you're not actually passing a proper bowel motion. So it's always important to address this issue and speak to your consultant or your GP if you are having any issues with constipation, diarrhea, or weak muscle and lack of control of your sphincter muscles. Bladder issues then. So some possible reasons for bladder issues. And I suppose to just discuss it at first, bladder symptoms occur in approximately 40% of people with Parkinson's, and there's multiple reasons for it. It may be weak sphincter muscles, again, so weakness in the muscles of the bladder. It may be a symptom of being on or actually being off with your Parkinson's. So if you are switched on, it may increase the frequency, but also similarly, if your levodopa level is lower in the body and you are wearing off, as we would describe, this may also lead to frequency and urgency of the bladder. Constipation can also cause bladder symptoms, as I have said in the last slide, as is putting pressure on your bladder because the bowel and the bladder sit quite closely together. Nocturia is something that a lot of people would report back to me that they experience. And nocturia is where at nighttime you have an issue with increased frequency for urination. So you may be up once or twice a night, or it may actually be 5 or 6 times a night where you're up to go to the bathroom to pass water and then back to sleep eventually, and then up again an hour later. So it is something that's very common. Overactive bladder is another term that you'd hear mentioned. And then there's the urgency. So because of the weak muscles, you don't have that control, and it's an urgent situation that you make it to the bathroom. So some prevention tips, I suppose, for bladder issues that you may experience. So fluid intake is reduced, and I would always say reduce it if you can, but don't restrict it. So be it maybe come 6 o'clock in the evening, you decide not to have any further fluids, or even 8 o'clock in the evening, so that it limits the amount of time that you may be up during the night. Or if you were going out and about, before you go out, make sure that you use the bathroom, but don't take large glasses of water if you know you're going to be restricted in finding a bathroom. Caffeine is always a stimulant, and a diuretic, so it'll actually make you go to the bathroom more frequently. So try avoid caffeine if possible, especially before bedtime. And your carbonated drinks and alcohol are stimulants. So it's worth trying to avoid these, at least to try and see if this aids the issues that you may have at night and alleviates some of the symptoms. Exercises then, so similar with the constipation and weak sphincter muscles, and the physiotherapist can provide you with exercises for Kegel exercises or pelvic floor exercises and bladder training, and these are proven quite effective. Medication, so as always with everything, there is medication that can be prescribed for overactive bladder or nocturia, something to be addressed with your neurologist or your physician. And clothing, so just be aware that if you're somebody who may be experiencing off symptoms, that you want to be able to access the bathroom quickly, and avoid having belts and buckles and zips and buttons and all that. So just make sure that you can try and access the bathroom as quick as possible without any interference from the clothing. Environment and equipment then, so if necessary, have extra equipment downstairs if you only have a bathroom upstairs, such as a commode or a bottle, or at nighttime have something by the bed if you are somebody who suffers from frequency at nighttime, to avoid you having to get up out of the bed all the time, or if you struggle to actually get up out of the bed, it's always something to consider. A person who doesn't empty their bladder fully, you may not be aware of it, but it may cause pain, first of all, but also it can increase the chances of urinary tract infections, because if you're not emptying your bladder fully, then the urine is sitting in your bladder stagnant, which is an ideal area for growth of bacteria. So something just to remember is try to empty your bladder fully to limit the possibility of a urinary tract infection. So in conclusion then, it's a very common issue. Both bladder and bowel issues are very common. It can be an issue that causes a lot of distress and embarrassment, but something that should have equal emphasis on and discussed with your Parkinson's nurse specialist or with your neurologist, because there is different management methods, I suppose, that can alleviate the symptoms. and can improve your quality of life. It's always a full assessment. So when you go to your neurologist or you speak with a nurse specialist, usually constipation is the first thing that I would ask. But it's also something to mention yourself, that if you are having issues with bladder symptoms, that you address it, because there is early management exercises, and the multidisciplinary team approach, as I've mentioned, the physiotherapist and the exercises that they can provide can help to improve the management along with pharmacologicals and medications. But sometimes exercises are effective enough, and in turn then decreases your distress with the issue, decreases your embarrassment about it, and overall increases your quality of life and control of the symptoms.